Thank you, everyone. Uh, it was a tough call when we were planning this particular summit for today to, one, use the word business, because in the last couple of years that I've been speaking to people professionals in the healthcare industry, everybody's very scared to use the word business when we're talking of healthcare. Second is, one thing that I've learned in the last 3 years is that we talk about the three missing or the things that need to improve in healthcare is the access, the affordability, and the standard of quality. And when we speak about this, what I've realized is that neither of the three could actually be achieved unless we start building institutions that are run sustainably, financially strong. Now, to run these institutions with this particular fundamental is to ensure that we become innovative in our approaches beyond just the outcome of healthcare. I mean, even the way we run these institutions. And the challenge that comes in when we are talking about such innovations is ethics. So, which is why we thought that, people who are at the helm of these organizations, who are responsible for not just innovation, but also ensuring that there's a balance between innovation and the ethics and the quality parameters. That's the basis of why we chose this particular conversation and this panel. So thank you so much for coming all the way and joining us this morning. Anand, let me begin with you. When we look at innovation, it is believed that usually it is an outcome of a culture in an organization. Innovation is a culture. It's not one thing that you just strategize and try and execute. How do you ensure that innovation, by being a culture, is becoming a part of your day-to-day operations in the organization?
I think as you rightly pointed out, in healthcare, the main aspect of healthcare, when you talk about it as a business, also is that it's a profit with purpose. So the purpose is always the most critical part of it. And the purpose, as we all know, is patient care. Patient care is the most important purpose of healthcare. And that's where we all, put all our thoughts around it when we talk about any aspect of it, whether it is innovation or profitability. So when you talk about how we build that culture in the organization, so the most important thing here is how do we benefit the patient? So what we are trying to do, how does it benefit the patient? And how do we actually improve the parameters that are important for patient care? So that's where I think all our aspects, when we look at, when you develop, when this industry itself develops, and how as an organization we also look at it. So when you talk about new things, when you talk about, say, you talk about a digitalization process or a digital transformation, or you bring in new things like, when you want to do a digital pathology. So how, it's an innovation, but how does it benefit the patient? So that's what you look at it. So, and how that helps. And it's not just about, whether it is a price, which is most important. What is the value that brings to the whole table? So also, as diagnostic players, we are part of the healthcare continuum. And in that, how do we actually add value to the patient and the overall process of healthcare? That's more important. And that's where I think that's the culture that we want to build into our organization as well.
Sanjeev, when we look at innovations, usually what we've seen is top-down approach. That, the CEO, the MD, they define that, ye karna chahiye, wo karna chahiye. But when it comes to non-medical innovations, a lot of these ideas can actually come from the people who are working on the ground. But as Anand was saying that, we are doing profits with purpose. How do you ensure that people who are working at the ground level understand the purpose and the impact that their work actually creates in the overall scheme of things or the business? And how do you include those people to innovate things that can be done differently, and they are the touch points for every patient walking in, every the patient who's the family of the patient that is coming along there?
Very interesting question, and I must tell you that it's not an easy task. It's quite onerous, really, to get everybody on the same page and make them understand the kind of business we are into. If at all, it may be called as a business. As you rightly mentioned, there's a taboo around using business with healthcare. So clearly, I'll take you about 20 years back, and when I was running a couple of hospitals, a few hospitals actually. We came up with this idea in one of the hospitals to come up with these good idea slips, GIS. And we thought that, people who are actually working at the grassroots, they are the ones who are interacting with the patients, they see the daily travails and tribulations. How do we really engage them, into the larger vision, the larger direction we have for the company? And very clearly, every time, you look at a problem, my thought process is that, and this is often said in our company, that whenever anybody is lost, anybody is confused, take a call which goes in the favor of the customer. For the simple reason that the customer is happy, I think you are sorted. So these ideas started flowing in, and then we'll have this committee initially, who would sift through these wonderful ideas which would come, and then we'll also recognize these people for the good ideas. So that's how we are able to kind of weave them in the, in the whole process. Another thing which I thought which was very important is that it is not a one-day affair that you pass on the information to the people and they'll start coming up with good ideas. I think you have to keep on brow-beating about the virtues of being in this sector. I have worked in multiple industries. Last 20 years I've been in the healthcare sector, but before that I worked in telecom, in textiles, briefly, in chemicals, etc. Healthcare is a very different animal. While loads has been said about, using your mind or the brains for running businesses, I would say that in healthcare you have to use your heart also. I think the idea is to alleviate the pain from the faces of the people who are coming to your centers, to your hospitals, to your diagnostics labs. So if that is the case, in that event, that every single day you tell them about the bigger purpose. The bigger purpose is we are trying to solve for three problems. As you rightly mentioned, one is the accessibility, second is accuracy. I'll put it for the sake of simplicity, I'll say three ACEs: accessibility, accuracy, affordability. Right? So unless until everybody is on the same page, I think the task is not complete. So every single day, in every communication, verbal, written, you have to keep on telling people why we are here, what the bigger purpose is, and put your heart and soul in the game, as opposed to just coming to the office, coming to the lab, coming to the hospital, and just going back after clocking those 8 to 9 hours.
Sanjeev, I noticed that you use the word customer, and I'm so glad that you did that, because the perspective of the CEO, the company changes, because patient to majboori mein aata hai. But when you treat him as a customer, you are delighted to have him there, and you're thankful that he's chosen you over anyone else. Dr. Gupta, let me ask you, Prabhu, I'll come to you after this. When you're looking at innovation in a healthcare system, especially a hospital, you are also challenged with the thought of being ethical, and you're also challenged with ensuring that there's a strict compliance to the safety standards in the institution. So how do you create a balance between how you want to improve as an outcome of something innovative that you want to do in your hospital, while ensuring that you are not compromising on any of the ethical or the patient-centric safety standards?
I think you have touched a very sensitive, very important issue. Innovation is a must. Technology development is the key of improvement in the healthcare system today. However, whether it is a clinical trial, whether it is a validation of a new technology, whether it is a validation of a new instrument or validation of any AI, the important thing is how critically, how meticulously, protocol-based it is validated. And that has been the challenge in the innovation, whether it is coming from any startup. And I chair the committee in ICMR, and we look for what could be the validation process of a new innovation. Who will develop the protocol for validation, where these validation will be done. And if this validation is done, is the patient safety compromised? And is the patient ethics is ensured? The informed consent is ensured. Standard of care is not denied. And the statistical and clinical validation improvement is ensured. And therefore, it is important that when we do a validation process, A, have a robust protocol, B, have a robust methodology for conducting it, ensure that the patient consent wherever is required is done, and 5, have a very good analytics, statistical as in clinical. That's the important thing. I will also add here that innovation can happen anywhere. Whether it is a startup, we must promote. Whether it is All India Institute of Medical Sciences, Delhi, we have now startups in AIIMS Jammu where I preside over. The startup platform in AIIMS Delhi also, and we are trying to have a startup set up at number of AIIMS so that they can also start the innovating system. Important thing in innovation in healthcare system is we should not work in silos. And I have seen, I chair the ethics committee of IIT Delhi and IIT Kanpur, particularly on healthcare setup. It has been seen, it was seen that the IITs, professors, PhDs, startups, they start working on a project which is not the unmet need in the medical profession. Whereas the medical profession doctors, they have the problem, but they do not approach appropriate scientists there. And that's why when I was dean at AIIMS Delhi, we started matching the AIIMS and IIT. We have a collaboration now so that both work in tandem, and there is an ethics committee which looks into the usefulness, how they are going to position it, how it is going to be cost effectiveness. I think that is something which is very important.
Dr. Gupta, you actually brought out a very, very important aspect because we've seen a lot of startups who are creating a lot of things for the healthcare industry, but they get stuck in the trial phase where that's when they realize that they should have included the doctors and the actual users in the planning and development stage itself. Prabhu, the reason we wanted to have you as a part of this particular panel was, as business leaders, when we are planning an institution or when we are running an institution and we talk about financial sustainability, there are two things that we do. One is looking at how we can increase the revenue, which means increasing our customer base and the business. Second is cost management, And what I've seen is many times when we are planning an institution, we look at the manpower cost, we look at the rentals, we look at the cost of operations, and we leave everything else to the architects, designers, procurement guys. But these are things at the background which are adding to the operational cost. How are things like air conditioning impacting the overall cost and sustainability of an organization? What is the latest development in HVAC that is there, which is reducing the cost for many of these institutions? I remember when I was at Google, we did not set up a data center in India because of the electrical cost that was much higher than the other country that we ended up setting up a data center at.
So good morning. First of all, thank you for making me part of this panel where we have the stalwarts from healthcare and I am the odd man out from a different industry. See, if you talk about air conditioning is one critical requirement for any healthcare segment. Okay, during COVID times, we had a big debate whether the air conditioning should be switched on or not. Okay, so air conditioning is not only to give you a comfort temperature, it is also being used to give a healthy indoor air quality. Okay, not only for the patients, for the patient attenders, and even for the healthcare service providers. So indoor air quality is also a part of air conditioning. So for that, there are a lot of changes which has happened post-COVID, in the design of air conditioning. For example, there are few add-ons or few systems which got introduced in air conditioning. For example, I would say like there is add-on called UV lamp, which is installed in the indoor of air conditioner. Generally in an indoor of air conditioner, this is the wettest part of air conditioner where the bacteria and your fungus will get formed. So the UV lamp will be focused towards the indoor unit so that it destroys the bacteria and viruses. Okay, one. And second thing, there is a activated carbon filters. Okay, so this will destroy the VOC, volatile organic components. Generally, this VOC will get generated through floor mats, furnitures, curtains. So all this will be there in the conditioned space, so it has to be destroyed. So this activated carbon filters does that job. Then we also have ionized bipolar ionizer, which will emit positive ions and negative ions. Positive ions will neutralize the dust particles, and negative ions will neutralize VOC and pathogens, which is there in the hospitals. So there are a lot of innovations which was done post-COVID, so that we take care of the health factor of the patients, attenders, and even the healthcare service providers. That is one. And second thing, when we talk about air conditioning, in recent days, most of the customer wanted a sustainable solution. Okay, in fact, the air conditioners are power guzzlers. It consumes almost 40 to 50% of power, in any hospitals. So they wanted a sustainable solution which, consumes, maybe the power should get reduced, one. And second thing, we also use refrigerant in the air conditioning system, which can be hazardous, for a patient. So what we do, to give a sustainable solution to customers. So there are a lot of technology which came in recently, like for example, inverter compressor, VFD compressor, oil-free magnetic levitation compressor. This will bring down the power cost by almost 15 to 20%, one. And second thing, if you talk about refrigerant, the refrigerant should be non-toxic and non-flammable, and it should have a low global warming potential. So there are some new refrigerant which has come in market, like R1233ZE, 134A, which is A1 classified, non-toxic, non-flammable, and it has got a low global warming potential also. Okay, and the third thing, there are some features which has been added in the air conditioning system, like the refrigerant leak alarm system and condenser prediction system. So if in case there is a leak in the system, you get an alarm, your technician can come and address the issue immediately. And if in case there is a condenser not clean, it can increase your power consumption, and it can also derate your capacity. So it can indicate, it can give a signal, and your technician can come and address the issues. So there are a lot of technologies which got evolved post-COVID.
So it's not just the cost, it is also the safety standards and the hygiene factors that are taken care of. Anand, many of the healthcare institutions today are being managed at the top by non-medicos, And like we were talking about, that we need to bring in efficiency in how we run these institutions. We are talking of the various P's of marketing. And the difference between any other industry and the healthcare industry is that the underlying factor of a business leader has to be empathy and patient centricity, right? But how, and we have to take decisions on the place where we're going to set up the institution, the cost, the promotions that we're going to use for getting more footfalls. I would hate to use the term getting more footfalls, but that's the reality when you're running an institution. How do you think as a business leader, we can bring sensitivity of ethics, being sensitive to patient centricity, empathy, while taking a decision on every aspect of the marketing P that we are, as a business leader, expected to manage?
Right. Ravindra, that's a very interesting question indeed. So when you talk about how do you actually manage these kind of situations, and also how do you inculcate that culture of empathy? Empathy or compassionate care is one of the key pillars of any healthcare organization. So when you actually think of that, how do you inculcate that culture? So one is, when you deal with patients, you're dealing with human beings, and that is a very important aspect where empathy is very constantly to be reminded of to people. And this happens very less in a laboratory environment, because if you see only the phlebotomists and a few front-facing individuals who actually handle the patients directly. But when inside the lab, it's more of a factory kind of a setup, so where you handle only samples. So how do you actually convey to the technicians and the technologists and the people who are working there as well, that what they're handling is not just a sample, but there's an emotion behind the sample. So every sample, there are patients behind it, the family behind that sample, and the whole emotion are tied out around that. And if it's going to be your own family member's sample, so how will you treat it? So that kind of a sensitivity, a sensitization is required And that is something which we constantly do to our patient, our employees as well. And also we also let them go through the whole process of how the sample's journey happens, and that gets tracked for the patient as well. So that when the patient also tracks the sample journey, so they also get the conviction that, you know, how the sample is being handled in the laboratory. And this awareness also creates that kind of responsibility on the part of the lab people to work towards improving the whole process. So that's where you need to do that. And when it comes to marketing, I think that's also a very important aspect when you talk about how do you actually do what is called as ethical marketing. How do you, whether you're going to just push on a number of tests to be sold, or you're going to ask your doctors to write more tests. So what is that you should do? So that's where you need to have a very scientific approach towards the whole process, where we say that, you know, you are going to talk about those tests which are important and which will actually help the doctors to improve their patient care. So the outcomes of the patients have to be improved by the tests that they do. If you are going to tell the hospital to have you as managing their lab, so what are the things that you bring to the table? It's not just about giving them a share of the business as a revenue, but it's about how you're going to improve the patient care. And, you know, things like, you know, what they measure, like, you know, ALOS, average length of stay. So how are you going to help bring down that, and how are you going to help them manage their patients better? So those kind of aspects is what we should concentrate when it comes to how we promote our business as you say, it's a marketing part of it.
Dr. Gupta, I want to reverse this question for you. Like we were talking of how do we bring empathy in among the various P's of marketing. Now when you're running an institution like AIIMS, where you don't need to market it, you're not bothered about the pricing, etc., the empathy, ethics are taken care of. How do you bring sensitivity to being an institution which is efficiently run, to ensure that how we could try and bring this institution to be profitable? You know, just because it is government run does not mean that, you know, isko chalne do, paisa lagne do, hame theek kaam karna hai. How can we, what are the efforts that are being made to make AIIMS a financially profitable organization?
Controversial question. The government-run institutions like All India Institute of Medical Sciences, the primary objective is not to earn profit. Return of investment of such institution is not money. Return of investment is to provide the quality care, affordable price to masses. That is the return of investment. How many people go satisfied after getting best of the best treatment, which is not available, is the return of investment. That's why any investment put by the government has to have a return of investment. I would put it, when a patient, like we have started OPD and IPD at AIIMS Jammu, which is now coming up. So now the perception of the people of Jammu and neighboring states is the same as that the perception of All India Institute of Medical Sciences, Delhi. Perception leads to expectation, because they think that when I go there, and then expectation when they go inside, they look for 2-3 things. The quality of, the convenience, and the cost. And the cost is, that means it is not the cost which is at the corporate hospital, it is much to be affordable then. And then, when you get best of the treatment, best of the investigations, and the convenience, and the turnaround time of the pathology investigation, radiology investigation, less of the hassles, then the return of investment is the confidence of the patient which he develops, and he will like to come back again to the same institution with the same confidence. That, oh, मुझे कुछ हो गया, तो चलो यार इससे सरकारी अस्पताल बाकी छोड़ो, corporate hospital छोड़ो जम्मू के, मैं तो AIIMS में ही जाऊंगा जम्मू के. That is the reputation. You build it. So, and that is what is the empathy. हमको advertise करने की ज़रूरत नहीं है. लेकिन this self-advertisement, it happens. And that is what something is important. And that means, and what I will just give you 2-3 things which we learned from AIIMS Delhi and which we started in AIIMS Jammu. is the patient navigation system. A patient comes at the gate of the AIIMS Jammu, he gets a navigation system, and there is a bus service which will take them, the digital, that is the electronic bus. It will take to the OPD, it will take to the IPD, and in IPD we have also the kiosk that if you want to go to this OPD, if you want to this lab, just press this button, मैं कहाँ जाऊँ, कैसे जाऊँ, वहाँ पे एक सहायक बना हुआ है, and then he will take it there. We've also created the digital platform there for the first time in Indian any AIIMS, which is now going to be in different AIIMS. First time the digitalization of all prescription right from A to the end. And this digitalization of prescription with one of the startup company in Delhi will tell us at the end of the day with CDEC association कि आज हमने कितनी प्रिस्क्रिप्शन में कितने एंटीबायोटिक किसने प्रिस्क्राइब किए and which antibiotic. That will also rationalize whether this antibiotic use is justified or whether it is contributing, and this will also plow back to training of the nurses and the pharmacists and also the residents and faculty कि आप ये इसमें antibiotic दे रहे हैं कि नहीं दे रहे. This will also reduce the uses of other drugs. This will also rationalize the what you call the therapeutics as per the standard treatment guideline. This will also give us the idea कि आज 3 महीने में हमने इतने एंटीबायोटिक या एंटीस्टेरॉइड इतने एनाल्जेसिक्स हमने खरीदे हैं, तो अगले 3 महीने में हमको कितने खरीदने की जरूरत है. That means you can predict, you can this, and you can also have the idea of what would be the impact of patient compliance, patient adherence, reducing drug adverse drug reaction. ये सारी चीजें will automatically act as a advertising or USP of the hospital. Absolutely. So we need not to put a big brand in the railway station or airport or things like that. This goes by word of mouth, and this gives a confidence to the faculty and the confidence to the public of the catchment area.
Absolutely, sir. I couldn't agree more with you. I mean, you use the word perception leads to expectation, and that's what the success of AIIMS is.
And lead to confidence.
And lead to confidence, absolutely. Sanjeev, you know, we've spoken about it. We've understood that empathy needs to be a part of every decision making in a healthcare institution. Can you share any incident or any point in time where you had an opportunity to innovate, which could have resulted in a lot of profit, but there were ethical issues, and what did you choose? Because I mean, you know, all of us can relate more to real decision-making moments than just stories.
Often I don't recall any such incident, but I can tell you, I can just to, you know, buttress this point since we're talking about empathy. Healthcare has to be outcome driven. A person goes to a hospital thinking that, you know, he'll get rid of the ailment he is or she is having, only to come out with another ailment. And this is so true. We have forgotten about how do we make patient well. So healthcare has now become, and I may be sounding a little pessimistic here, but what I see is oftentimes, and Dr. Gupta, please bear with me, what I feel is that, you know, we try to treat the disease, not the patient. And so it is very, very important. If we talk about empathy, we have to huddle. Probably it could be an ego issue, it could be. So why can't the doctors huddle in the morning and discuss a critical patient as opposed to just a nephrologist? If a person is coming up with a kidney issue or if a person is coming with a heart ailment, can't we, you know, huddle together 4 or 5 specialists and talk about the patient as a whole, right? So if the closest come to my mind is, since you're asking for a live example, it is very difficult to make each and every super specialist, you know, sit together at 7:30 or 8 in the morning before they start their procedures, they start taking the rounds and talk about the patients. So one is that, you know, we started this in, you know, a couple of our hospitals where, you know, we made it a point that the doctors should come, talk about the patients, and ensure that they leave the patient, they leave the hospital hale and hearty. So this was one thing which we do. Secondly, if I have to draw a parallel from the diagnostics industry, a person comes, gives us a sample to find out what is ailing or what is the diagnosis of that particular ailment. Now the problem comes that, if you are giving a result which is a confusing or ambiguous result, you say it is a borderline case. Just to give you an example, there's a test called NIPS, non-invasive prenatal screening. When a lady is carrying a child, then you can, or fetus, you can make out if the child is going to be prone to certain diseases. So if it can show you borderline, it can show you high risk, low risk, and then borderline also. Can we use some other methodology by virtue of which you can buttress or you can, corroborate your finding, whether it is a low risk or high risk or borderline case, and give a conclusive result? So I think these are some of the things which you can do. Putting the patient first means that, you have to give them something, which is absolutely conclusive within the defined timeline so that the treatment can start immediately.
Absolutely. So it's about value creation as well, going beyond what you're expected to do anyways. I think, I have a lot of questions which I could have asked. Could be some are controversial, as Dr. Gupta mentioned. In fact, this patient experience thing, if I had extended to him, it could take another half an hour. But it's been a beautiful panel, and some of the things that have actually come out is the powerful point that perception leads to expectation, that leads to confidence. I mean, this is not just for the government-run institutions. I think it should be a paradigm for every healthcare institution, even in the private sector. Second is, what beautifully came out through conversations with Sanjeev and Anand were that, empathy needs to be a part of every decision making in the healthcare institution. We have to look at what is the experience that we are creating, how patient-centric it is, and we must understand that somebody needs to pay for it, whether it's the government in case of AIIMS, where they're not bothered about profiting, but patient outcomes and the experience, but somebody needs to pay for it, whether it's the government, even in a charitable organization, there needs to be a donator who needs to come and pay the money, or in a private institution, it's the patient who's paying for it. The focus has to be on the experience that you create. Even at AIIMS, when you go, you're getting the best doctor, best treatment, but getting the hassle of getting admitted or getting the appointment, etc., needs to be taken care of. I mean, it's the guy who's sitting outside, the assistant to the doctor, the way he speaks to the patient, वो patient already बुरे हाल में है, तो वो चीज़ कोई something that needs to be managed. So the purpose has to trickle down to the lowest level on ground, and it's about building efficiencies. Prabhu, you brought on some issues which can actually lead to cost control and also safety, which is beyond the medical safety. So thank you so much all for taking our time, and thank you for allowing me 5 more minutes.